A new study suggests that teens and young adults who vape are more likely to test positive for COVID-19. Fox's Catherine Hawley has more.
The study was published this week in the Journal of Adolescent Health. The data coming from more than 4,000 teens and young adults who all responded to an online survey, linking the habit with contracting coronavirus.
We're able to show that children who had recently vaped, even within 30 days, or were actively vaping, were significantly higher than teens who didn't do those things.
The researchers from Stanford University found people between the ages of 13 and 24 who use e-cigarettes are 5 times more likely to be diagnosed with coronavirus compared to their non-vaping peers. That number jumps to between 7 and 9% in teens and young adults who both vape and smoke traditional cigarettes.
It's not at all surprising that children who have COVID-19 and vape get sicker. And that's actually something that we're studying here at All Children's.
Medical experts say there are a number of factors that may play a role in the increased susceptibility of young vapors testing positive for the virus. And this isn't the first study to link smoking with a higher risk of infection. There's evidence that e-cigarettes make the lungs more vulnerable to a variety of different infections.
It actually causes inflammation in not just the lung, but we actually suspect that it causes inflammation throughout the entire body.
What makes this correlation even more concerning is data from a 2019 national survey that found more than a quarter of high school students use e-cigarettes. Dr. Sochet says it's a reminder that there are other health issues still going on that need our focus.
Again, prior to COVID-19, vaping was our pandemic that we needed to tackle as a society.
Doctors say all of your personal habits and behaviors play a role in your risk of contracting and transmitting COVID-19.